For Maple Ridge Mission, and I'm here on behalf of all my legislative colleagues who represent the Fraser Health Authority region, everyone from Burnaby to Surrey to White Rock, Hope, Chilliwack, Mission, Maple Ridge, and all the communities in between. And joining me is co-host Joan Isaacs, who's the MLA for Coquitlam Mountain. And we have special guests with us, Dr. Victor Lee, President and CEO of Fraser Health, and Dr. Martin Lavoie, who's the Medical Health Officer for Fraser Health. Of course, first I'd like to acknowledge that we're here on tonight on the traditional territory of the Katzie and Kwantlen First Nations, where I am, and of course want to recognize that you may be joining us from territories throughout the region and around British Columbia. So welcome and thank you. So it was actually last month that my colleagues MLA Singh and MLA Martin held a town hall so that your questions could be addressed by people who have been leading the COVID-19 efforts in the Fraser Health region. And as we know, a lot has happened in the last month, and I'm pleased that we have another opportunity to get together and have your healthcare related questions answered by Dr. Lee and Dr. Lavoie. Before we begin, I wanted to thank all the healthcare workers and those on the front line for their amazing job over the last few months. What you've been doing every day to protect our province from COVID-19 and ensuring that people in British Columbia continue to receive essential goods and services has been amazing. And it was just a few minutes ago that we were all cheering away with our pots. Woo-hoo! Anyway, that's my comedy. That's about all I got. So just a few minutes ago, but seriously, everyone, it's so important to recognize everything the essential workers have done and also recognize some of the stories that we hear in our local communities. In Maple Ridge, we have a young boy. His name's Quinn Callender. He's a 13-year-old Boy Scout, and I'm sure you may have read about this in the newspaper, but his mom found out that there was a need for certain mask plastic connectors in the back, and Quinn had learned how to 3D print in his 3D printing club at Hammond Elementary School. And so him and his dad, they found a design and they started printing and sending them out to healthcare workers for free. And his mom took a photo of this, and it in fact went viral. He ended up on Dr. Phil and was in Forbes magazine 8 under 18, and now he's printed over 1,000 ear guards. And you know, this is just one story of so many around the province of people who have really risen to the occasion and also just celebrated so many important things. It's fun to see, for example, the Sunwood Retirement Home in Maple Ridge. They go out every evening at 6 o'clock on their balconies and sing "O Canada." And also businesses. One of our local businessmen, Gary Torr and Jason Tigan, donated $10,000 to the Mission Community Services Food Center, and they challenged everyone to jump in. And of course, people donated everywhere from $25 to $2,000 to the Mission Community Food Center, and they ended up raising $55,000. And as I said, these sort of stories are happening all over and supporting the people that really need the support. So I did want to take the time to thank everyone in Fraser Health and everyone all over BC for doing what they've done to flatten the curve. This has taken every single one of us. I wanted to thank you. And now I'd like to I have the pleasure of handing the mic over to MLA Joan Isaacs to give us a quick overview of what this town hall is going to look like. Joan?
Thank you. And thank you, MLA Deeth, and all the people that are stepping up to do all these amazing things during this COVID-19 period in this pandemic time. It's just great to see people just being so generous and generous with their time and coming together with so many unique ideas and sharing all these great ideas. And so welcome everyone. And it's great to see our colleagues from all parties as well as our health authority leadership working together so that people in British Columbia have the opportunity, like we have here tonight, to have your questions answered by our public health experts and our healthcare leaders. I also want to say how proud I am of the people in my riding, as well as all around Fraser Health and of course across British Columbia. And I thank each of them for stepping up and all the sacrifices that you have made to flatten the curve. I'm so happy to see that the outbreak that was in Dufferin Care Centre has ended, and we send all of our heartfelt condolences to all the families of Dufferin Care Centre and all the families across BC who have lost a loved one because of COVID-19. So it is my pleasure to introduce our special guests tonight, Dr. Victoria Lee, who is the CEO of Fraser Health, and Dr. Martin Lavoie, who's the Chief Medical Health Officer of Fraser Health. And I would like each of you, Dr. Lee and Dr. Lavoie, to introduce yourselves and tell us a little bit about what your role is.
Thank you very much, Joan and Bob. It's been a privilege and honor to lead Fraser Health during the pandemic as the CEO and president of the Health Authority, and a large health authority with 1.8 million people and 20 municipalities, that some of those that you mentioned earlier this evening. So looking forward to this evening, and thank you again for the introductions. And again, I'd like to acknowledge all of the people that have been in the health system, all the healthcare workers, as well as people that are behind the scenes that have made our response so effective, and also all the sacrifices and generosity that our communities have demonstrated all throughout this time as well. So thank you.
And good evening, I'm Dr. Martin Lavoie. I'm the Vice President, Population Health. And also the various inspections we're doing in various types of facilities. And so they're working really hard. I'm also responsible for the team that is monitoring the situation of what's happening and where it's happening and how fast and all these things. And also leading the team that is taking care and working closely with our First Nation communities and also First Nation Health Authority. Thank you.
Great. Well, thank you for all the work that you're doing, and thank you to all the healthcare workers for the work that they're doing. And we especially are grateful for you being here tonight on a Friday evening and helping us to host this COVID-19 town hall. Now, in advance of this town hall, we've asked British Columbians from across the province to submit their questions related to COVID-19. MLA Deeth and I will take turns reading out the questions, and either Dr. Lee or Dr. Lavoie will address them. If you're watching from the Government of BC Facebook page, you can also submit your questions starting now in the comment section down below, and we'll have a chance to address them shortly. So we're going to move right away to begin our questions. And the first question is over to MLA Deeth.
Thank you very much, Joan. And so the first question actually is one that's dear to my heart, having 5 kids and one grade 12 student who's dealing with not having grad this year. And so this first question is about, obviously, about the pandemic and how it's really changed the way in which we live our lives. And there's many things that we haven't done before, and folks are looking for tips on how they can navigate this new normal, as Dr. Henry refers to it. So this question for Dr. Lee and Dr. Lavoie, Melanie from Surrey asks, can you please, offer some tips and suggestions for teenagers navigating the second phase of this pandemic? Sometimes it's good for teenagers to hear from someone other than their dad in charge who aren't their parents. So please, if you could answer this, I would be very grateful.
So I'll start. That's actually a very good question. I think everyone, including teenagers, including kids and parents, and everyone is actually part of this response. Everyone has a role to play. And when I say everyone, it makes a difference when everybody does it. So all the recommendations, all the measures that we've talked about to protect others, to protect ourselves, to protect our families, it needs to be done by everyone. This is what makes a difference, and this is what is flattening the curve. And I think in BC, we have seen a big difference, and we have flattened the curve, and this is why we have now just entered the second phase, with slowly reopening a number of facilities and businesses, and changing slowly what we're doing and the way we're doing it. And so, if specifically for the teenagers, this is not the time to do the opposite of what we're saying. I think it's potentially life-saving what we're doing and the way we're doing it. So that's my advice. Everybody needs to be part of this. This is how we're going to make a difference, and this is how we're going to get through this together successfully.
Yeah, and I'll add to Dr. Lavoie's excellent response that I think sometimes it can be very challenging, especially during this time, to have had so much time apart from people. And I think it's always a good reminder that you can be physically apart, but socially connected. So the teenagers especially are very adept at using a lot of different platforms. So I think it's very important to ensure that that connectivity with your friends and with your loved ones and your family continues during this time. And as we get into restart, you can increase some of those circles as well, which is positive. I also think that there's a lot of resources that are available for mental health, as well as services that are virtually quite attuned to the needs of our teens. So those are available, and links are available from Fraser Health as well as provincial websites. So I would encourage teens to look at those resources as well.
Good advice for teens and parents. So that's great. So we've been staying at home, flattening the curve. We've all been doing our part to make sure that we're not spreading COVID to our loved ones. And now we're entering phase 2, which is the BC Restart Plan. Of course, it began this week, and businesses are very slowly beginning to reopen. There's a lot of anxiety about what to do, what is safe, what is not safe. And Irene in Abbotsford is asking, with the reopening, is it safe for someone in their 60s or their 70s who have heart issues or diabetes to go out to a restaurant and to a bar?
So this is actually a very important question. It talks about a few things here. It talks about some people in BC are at higher risk of COVID-19, the disease, the complications, and the severity compared to others. And so we've mentioned here people who are older and people who have medical conditions, particularly when these are cardiovascular, respiratory in nature. And so we have to be extra careful. Now, that being said, we have put guidance in place for, and in this case, we're talking about restaurants, so that restaurants can start resuming some of their businesses in a different way. That's what we call the new normal. And there is a way to do this safely. So they need to look at the guidance and assess their situation, the way that their restaurant is running and the physical layout and all the processes. And they need to create a plan and implement that plan. So once that is done, it is safe to go to restaurants. Of course, as an individual, you always have the choice to reduce the risk even further. I mean, COVID-19 is still circulating a little bit in our communities. And so it is entirely to the person to decide that they could stay away from restaurants if they want to eliminate that risk. But again, this is why we have created guidance, is to make it safe to do a number of things now in a new way, in the new normal. And restaurants are part of that, and they are adapting. And I think it takes a bit of time also to do that. There are multiple steps to take, review everything. Really, we have to think about all the small details in terms of how people come in, how they circulate in the restaurant, the distance, how they order food, how the food is served. And so, but there is a way to do this very safely. Great.
Okay, well, the next question we have is also about businesses, but this one's a little bit more about individual people working from home. And Karine from Chilliwack asks, is it safe to go to a hair salon in an individual's home who only has, let's say, one salon chair and one sink?
Yes, this is a similar answer. I think each type of business has a way of doing things in a different way, if you will. the new normal, and they need to adapt. So all types of businesses, including hair salons, whether it's a large one or a small one, and even in a private home, there are things that people can do to change the way they do things, the way that they receive people in their house, and the way that they proceed with the haircut, for example, or the hair color. And so again, they have to create a plan to reopen safely, and they will have to change or modify a number of things in the way they're doing those things. And that will actually make it safe to use those services.
Great. So a lot of people have been on a list for elective surgery or surgery. And of course, that was postponed over the last few months. But last week, the health authorities have been calling patients back who had their surgeries delayed by circumstances of the pandemic to prepare them to resume for the non-urgent scheduled surgeries that would start this week. We've received a few questions about surgeries, including one from Jagreek of Surrey. And he's asking, his mother-in-law was due for knee surgery. She's been waiting for more than 1 year for that surgery. She's in a lot of pain. Her knee is swollen. It's very hard for her to move around, and she's a senior citizen. And he would like to know, when are you going to allow these kinds of surgeries in hospitals?
Yes, thank you for that question. It's an important question. As you mentioned, we have restarted our elective surgeries. Of course, during this time, elective surgeries and being canceled was an important part of our pandemic response and ensuring that we have enough access capacity flow in our hospitals. So thank you for your sacrifice and your patience during this time. And I'm sorry, of course, to hear about your mother's knee. And I know how painful it can be, having been in the clinical world before as well. So we're doing everything that we can to first call all of the patients where the surgeries were postponed. So there were about approximately 4,674 cases where we had postponed elective cases during the time. And we're making lots of good headway. Just in 10 days, we had about 840 calls that we made. And just already this week, we've had scheduled about 760 elective, urgent, emergency oncological surgery. So we're doing everything that we can, and our, of course, healthcare workers are working as hard as they can to provide those services very promptly. And in terms of timelines, the way that the surgeries will be prioritized will depend on urgency, how long the people have waited, as well as the types of service that it requires, whether it requires inpatient service or day service. So all of those will be taken into consideration. And again, thank you for your patience as we rapidly move through those postponed elective surgeries.
Great, thank you very much. The next question is actually still on the theme of surgeries. Alyssa from Surrey asks that, she says, I'm still waiting for my date for my urgent surgery that was postponed. And my question is, if there's a giant increase in COVID cases due to the opening up of services, will surgeries once again be postponed? And if so, what data or numbers could lead to that? And would you still allow urgent surgeries that did not fall under the previous restrictions to occur? So actually 3 questions.
Yeah, those are a number of questions, so I'll have to make sure I address all of them. So again, really appreciate people's patience, and I understand and appreciate that it's been difficult and the sacrifice people have made as the surgeries have been postponed. In terms of how we're managing our surgical cases and numbers that we are scheduling, we're doing it in a very safe way. So we have learned a lot from our experience with COVID-19. Postponing surgeries was an important part of our response. So we are looking at our number of cases very closely, looking at our capacity in our hospitals very closely as well, monitoring, of course, what the trend looks like in our provincial picture as well as nationally, internationally. So all of those will be taken into account whether we will trigger that postponing of surgeries again. At the end of the day, our ideal situation will be that we're very well prepared and doing things differently and have learned from this experience that we would not need to do this again in terms of postponing surgeries. However, I think that is an option that we always have to look at just in case if and when the second wave does occur. And the other component about prioritization of the surgeries, again, everybody's working very, very hard to go through those wait lists as quickly as possible, and we will be addressing them as quickly as possible, but I can't unfortunately give you a timeline. But as I mentioned earlier, a significantly large number, about 758 surgeries were already conducted for this week from the 18th until the 24th. So I'm very optimistic that with all of the work and dedication commitment from our healthcare providers, that we are well on our way to work through the wait list, as well as to ensure that we provide these necessary services to those that are in need. So thank you for that question.
Thank you. That was a lot there covered with a lot of multiple questions. So this week there was a lot of interest in masks, and our pre-submitted questions had quite a few of them. Stanley in Surrey is really concerned about the use of masks, though. He's saying, we were told wearing mask is a personal choice, but many businesses like Costco, Uber, grocery chains, etc., are making it mandatory for clients to wear masks before they enter the premises. But masks are not available anywhere. Can we recommend that these businesses stop discriminating by not allowing us to purchase masks or to enter without masks, or make masks available for purchase at affordable prices? So I guess what he's asking is, if you don't have a mask, are the businesses discriminating against you by not allowing you to enter? And if they must have a mask, should they not be made available to purchase right when you enter the store?
That's actually a very good and a very interesting question, because it talks about the role of masks or non-medical masks to be worn by the public in different places. And so private businesses have the right to request a number of things, and they've decided to request that people wear a mask when shopping into their stores. So I'll talk about the use of masks first, and why or when it could be actually useful to make a difference. And then we can talk about that particular situation. So masks usually are recommended, certainly in the healthcare sector, and this is very clear. And it is usually not recommended in most other instances, but it has a role to play. So we've talked about a number of measures that we can implement, that we can take, that will make a difference. So the physical distancing, 6 feet apart, that's very important. Also the hand washing, not touching your face, not going out if you're sick, and not being close to people who are sick. These are the most important measures. Now, some people are, like technically you should not have somebody sick walking around, and most people out there, the vast majority, are asymptomatic. They have no symptoms, they're not infected, or they don't have any cough or sneeze or anything like that. But when we talk, we can expel some droplets from our mouth. And so in certain situations where you cannot guarantee that you're going to be able to maintain that safe distance, or that you're not going to see somebody who is actually coughing or sneezing, there potentially is a role for masks. But interestingly, and that's not, it seems counterintuitive, is the role of the mask is mostly to contain your own droplets. So it's in terms of protecting others, just in case you have COVID-19 and you would actually spread your, or cough or sneeze your droplets onto somebody else. So it's mostly not for the wearer, but for the persons around you that masks can make a difference. They can make a slight difference. There's no evidence or proof scientifically, but they can make a slight difference protecting you if you are very close to somebody else who potentially has COVID-19. So that's the first part. So masks in public, they can have a role, but in particular situations. Now, if we look at businesses or stores who are demanding or asking that people wear a mask inside their store, they might have witnessed that people are not following all the rules in terms of physical distancing or things like that. And so one thing you can do certainly is you can talk to the owner of that store and see if they, if they can make that optional. But that being said, having a non-medical mask is a fairly easy thing. You don't have to purchase a large number of them. You can actually make your own. You can just use fabric. And actually, there are multiple websites that show exactly how to do it, and it's pretty easy. I saw one thing, I was looking it up earlier because it's like, how do you make your own mask, just out of curiosity. And one easy way is you can use a t-shirt and you can cut the bottom and it's kind of a loop. And so you can just cut it in a certain way and there you go, you have a mask. And so you can use it many times, you can wash it and it will do the trick. And so that would be certainly sufficient to go into a store that's requiring the use of a mask.
And one of the things that Dr. Lavoie has said that really resonated with all of us was that using a cloth mask is just like coughing into your sleep. So you're protecting other people from your droplets as you cough, or if you have droplets. So I think that's a good comparison. And I was just going to say that it seems like there's so many of those do-it-yourself mask videos. You can seemingly make masks out of every kind of, I think I saw one on socks. You mentioned t-shirts, et cetera, et cetera. So there's a lot of options out there.
Great. Well, thank you very much. Now, keeping on masks and personal protection equipment, perhaps, Dr. Lee, if you wouldn't mind addressing this question from an individual who wanted to remain anonymous. And the question is, why are staff at Abbotsford Regional Hospital not being given adequately provided PPE?
Yeah, and for folks that don't know what PPE stands for, it's personal protective equipment. And of course, health and safety of our staff and medical staff are actually the most important thing for the organization. And as you mentioned earlier, people have given a lot and sacrificed a lot every day to ensure that we're providing all of the essential health services. So having PPE in providing direct care has been one of those essential foundational pieces for us. And I think the person is referring to the Abbotsford outbreak, and there's been some misinformation that circulated that there was shortage of PPE or questions about PPE. There's been quite a deep investigation about how the outbreak occurred at Abbotsford Regional Hospital, and I can assure you that there was no evidence at all of PPE shortage. And I also want to commend our staff and medical staff, because all of the PPE, we call it donning and doffing, so putting it on and taking it off. Sometimes it can be quite difficult to do that appropriately and properly. And we also found through our investigations, everybody was doing their job in terms of using PPE appropriately as well. So I want to thank our staff and medical staff on that very difficult outbreak, but we're pleased to see that people have been following the guidelines and also can reassure folks that there was no shortage of PPE that led to the outbreak at Abbotsford Hospital.
Great, thank you. So along the same lines, we have a personal health question around masks, and it comes from Kathy in Maple Ridge. And Kathy says, I'm an extremely high-risk individual female, age 55. I have no immune system, go to the hospital every 2 weeks for an infusion of immunoglobulin. I have 2 autoimmune diseases, heart issues, and lung issues. I would like to know if you will make medical grade masks for individuals as myself so that I can leave the house and feel safe.
Yes, so you're describing a number of conditions that would actually put you at risk, and I think you know that very clearly. So I think it's important to protect yourself. So when you go out, and also when you go out for your appointments, and there are actually masks out there that you can purchase and to wear. So again, I think the mask is providing some protection, but it's mostly for the people around you. technically to be fully protected, you would need a mask and also goggles or a visor. And the idea is that if you are close to someone who is coughing or sneezing, that the droplets don't end up in your eyes or your mouth or your nose. And so that's the idea, is to protect you. You'd have to have this whole protection. So the mask itself provides some protection, but it works in combination with the other components. So there are masks that you could use for that. And technically, with the other protections, it would be protecting you. But also, I think what's even more important is to be safe in terms of staying away from other people. Again, the 6 feet is very important, minimum. And also, if you don't hang around people who are sick, and you can ask people to help you with your errands and groceries and things like that. And also, when you have your appointments, you can go directly to your appointment and come back and take all those precautions. It is challenging when you have all those risk factors. And eventually the pandemic will be over, but in the meantime, you can take all those measures to stay safe. I hope it helps.
Great. Of course, we have to continue to thank our healthcare workers for everything they've done to keep us safe over the last the weeks and months. But we also all have to think about keeping them safe as well. And this question is actually in regards to home care nurses and masks. And Loretta in Abbotsford asks, I heard that home care nurses who attend patients' homes are given one mask for the entire day, regardless of whether they are attending homes with both patients that have COVID-19 and those that don't. And how safe is this?
Thank you for that question, and I appreciate that people also care for our care providers, and that's important too. So for home care staff, there's multiple things that we do, and again, we follow best evidence and provincial guidance on what kind of PPE is used, as well as how we use PPE in these settings. And in home support, home care, what we have is actually personal screening of all of the symptoms before any visits are made. And we also screen patients or people that we are visiting at home to make sure that we have additional protection if it's warranted. So if somebody's exhibiting symptoms of COVID, we would have additional PPE that's available as well. But certainly not one mask a day, but they'd be using goggles or some sort of eye protection, as well as masks, and enough masks so that you can change them if you soil them or if you're having breaks, as well as if you, just in case you touch them as well. But there is also guidance around not changing out some of the masks when you're in direct care areas, if you're on a shift, so not in home support, for instance, but if you're in emerge department, sometimes it takes more to put masks on and off, which can also increase risks. So there's sometimes guidance that's related to not changing them for each patient as well. So again, we follow provincial guidelines, that's evidence-based, and adequate PPE supplies are provided whether you're in home care or emergency department. So thank you again for that question.
Great, thank you. Just going back again to reopening the economy and back to getting businesses up and running. We have announcements of government plans to slowly start reopening BC after all the hard work that people have done to flatten the curve. But there are some specific questions, and this is from Jamie in Pitt Meadows. And he says he's concerned about my wife returning to work as a dental assistant. From what I've read on the American and Canadian Dental Association websites about the aerosol created by procedures and the lack of higher than level 3 surgical masks in BC makes me worry. I believe many employers can in no way prevent these aerosols being created or control them. And I've read that they could be airborne for a long time. What's your advice to Jamie?
That's a very good question. It speaks to a number of things. One is, so the way to restart, as you said, restart the economy and reopening businesses and allowing services to resume again, we have created plans in different ways in this province. And so there's WorkSafe BC has worked on various guidance documents and some are general in nature, some are specific to the industry. But we also have, in this case, we have a regulatory body, the college for the dentists, and they are responsible to provide guidance in terms of how to provide services safely and also during COVID-19. And so that's the first place, is they are responsible to assess the different types of situations and the different types of procedures that dentists could actually be performing. And then for these, guide in terms of the type of PPE and how to do this safely. So that's the first place. Of course, owners of businesses or dentists, so the professionals themselves who hire people to work in their office, are also responsible to following those guidelines, creating a plan for their own office, and implementing that plan. So that will include all sorts of things that I've mentioned before, the same, including the use of PPE and what could potentially create aerosols in terms of procedures that they would be performing on their patients. Now, I'm not a dentist, so that's why I would rely on the expertise of the regulatory college and also from WorkSafe BC. So when we talk about aerosols, there's a lot of information out there. So we just have to also realize that it needs to be in the context of dental practice. And I don't know if there's a lot of information specific to that, but I've seen information on aerosols that could be mechanically generated, which is not in a normal situation. So yes, you can create an aerosol mechanically with some devices, but this is different from real life out there in the clinical world. And so I would actually, you can look up on the college, the College of Dentists in BC, or you could contact them directly if you wish, and ask specifically about that. And they will inform you what type of procedures could actually aerosolize secretions and what would be done in those instances. There are ways to do this safely as well, and we talk about a different type of mask if that's the case. But then also you would need the visor or the goggle protection for your eyes as well. Now, we're also entering a phase where the number of cases, the incidence of COVID-19 is lower, much lower, and hopefully will continue to stay low and even maybe go even lower than this. And so we'll get to a point where the risk of COVID will be very low or low in BC. And so you put all these things together, and so you look at the type of procedure, the type of measures to put in place in a dental office, and the actual risk out there. And so dental offices can resume their services safely. And I would just invite you to look at the information or connect with the college directly.
Great. Thanks very much. Here's a question from Edward that it's a very simple question. Just kidding. It's one that many, many people have been asking, and that is, what dates are we looking at for British Columbia entering phase 3?
So it seems to be an easy question. It's actually no, but it's good because it's actually a tough answer. It will depend. And so I think we have a general sense that in a number of weeks, we will be able to move to the next phase. And what we're doing in BC, and I think it's very wise, is that we are slowly, gradually reopening or relaxing some of those measures that we had put in place. And we wait a little bit. And so we need to wait long enough to make sure that things are not changing, that COVID-19 is not starting to crop up again. And so we need to wait long enough to be able to see some of those indicators, those things that we can measure. For example, the number of people that have symptoms that show up to get tested, the number of actual people testing positive, and to see if it continues as somewhat of a flat line, low levels, or if it wants to come back up again. And of course, over the course of a number of weeks, then we have a number of things that we're going to be keeping an eye on, and then we will be reassured, hopefully, and that's what we're hoping for and that we're expecting. And after a few weeks, then we will be able to say we're moving to the next phase. So there's no exact date, and if all goes well the way we're thinking, it's a number of weeks.
Great, thanks.
Great, thank you. So this is our last pre-submitted question, and then we're going to move on to the Facebook Live questions. And this again goes back to the reopening process. And this is with regards to opening up a gym. And people are saying that they just can't wait to get back. We've all heard of COVID-19, so some people are more anxious than others. But this question is from a person in Surrey who would like to know about the safety measures that's in place. So he's saying fitness facilities are being advised to maintain a minimum of 2 meters, 6 feet between all clients that are working out. However, he's asking if this should not be increased due to people working out, breathing heavier and releasing more droplets and aerosols into the air. And he's saying that these are likely to travel a greater distance with air turbulence, especially aerosols that are less than 5 micrometers in diameter. What's your advice on going back to the gym?
That's actually a very detailed question. So yes, I'm happy to provide some guidance here. So we have actually discussed this specifically between the Chief Medical Officers of Health and Dr. Henry, and also people at BC CDC, specifically actually not long ago. And so we have looked at this, and we still believe that 6 feet is sufficient in this case. And I agree that, of course, when people breathe more heavily, but the droplets, they actually slow down very quickly and drop. And so we are advising 6 feet is sufficient in those cases. And that's not certainly not the only measure. The distancing is extremely important, but it's also in the gym, recommendations in terms of cleaning, enhanced cleaning, regular cleaning between uses, between people, having people actually rotate or move, and so we don't have too many people at the same time, and we allow enough time in between the use of one piece of equipment and another to be so that it can be clean in between, the hand washing and all these kinds of things, and also removing access to shared like the water fountains, for example, or the food court and things like that. And so there are multiple things in the guidance documents for gyms that actually just came out recently from WorkSafe BC. And this will ensure that going to the gym is safe again. But it's going to be in a different way. And it's the new normal, and it will look different. It will feel different, but people will be able to exercise. It will limit the number of people, obviously, in the space that they have. And it will take a bit longer, but it will make a difference, and it will be done safely.
Great. Well, thank you for that. So our first Facebook question is a short one, but it's an important one. And it's from Alana. And Alana is asking, how long do tests take to process?
Yes, for the test, well, there's the whole sequence of things that happen for a test. So the person shows up somewhere, and then you actually take. So we're going to talk about two tests. The first one, the one that we know now, is the test that we take a specimen, usually through the one nostril, and we have to scratch a little bit at the back of the throat to get some cells. And so that's done pretty quickly. And so then the sample is then sent to the lab. And so there's a transport component. So that depending on where the assessment center is, then it needs to wait for the next carrier to come over and then transport this to ultimately to the lab that would be performing the test. And so, and then at the lab, there's all setting up the whole, like it's multiple tests done at the same time. And so they all need to be prepared and organized. And then there's a phase, the actual machine takes time to prepare the samples properly and then do the test. Overall, what we say is it takes easily up to 24 hours, but no, actually that's not true. Now it's less than 24 hours, but it can be up to 24 hours. It's fairly quick. So you put all these things one after another, and it takes a bit of time, but it's actually pretty quick. I think we're doing pretty well now. We've increased our capacity in BC, so now we can test in multiple places, and it has made a big difference. So the blood test is, it's a different test when we start using it to detect antibodies. We're still in the assessment phase. It'll be similar. It'll be, the sample needs to be taken, transported, and tested in the machine. So it'll be probably a number of hours, depending, because if you're at the site where the lab is, it might be a bit quicker. And if you're in an assessment center that's further out, it'll be a little bit longer. But on average, things will happen within 24 hours.
Okay. So the next question online from Ian is, are the regional health authorities considering possible future systems or mechanisms for regional advisories, restrictions, in order to keep our communities appropriately protected, but also able to function? I guess the question is a one-size-fits-all approach across the entire province sounds potentially both dangerous and more costly.
Okay, yes. That's actually a very interesting question to think about. So COVID-19 is spreading in our communities. It came in, a few people came in, at the beginning it was through travel, and then it started to spread across almost all of our communities. And so we are thinking also that it is slowing down similarly across all our communities. Not exactly at the same time, but similarly. And so the one size fits all, we can take it in different ways. I think we are reopening. So phase 2 is starting. It did start a few days ago for everyone. But at the same time, we're not one size fits all, because we're looking at each type of industry, each type of business. And even within that, all the restaurants are not the same. And the layout, the way they process things, the way staff move, the kitchen, the location, all of these things are different. And so that's why the guidance it kind of requires owners and operators to really think about each of the steps and how things are happening in their own location. And they need to adapt then very specifically to make it work in their setting. And so it's a mix of one size fits all to some extent, but it's also very, very specific, so that everybody can offer services or their business safely by adapting very specifically to the way they do things based on how their business is running.
Yeah, and I'll add to that, because such great questions tonight. So I think in terms of that question, there's also a part that sometimes we have different things happen in different regions. So for instance, in the Fraser Health region, we had worked very closely with federal correctional facilities, because there's 7 out of 8 correctional facilities that are in our region. And there was quite a large outbreak at the Mission facility. And when you look at that, you learn from that experience. And what we start with as a regional guidance and how we deal with that outbreak can become provincial as well. And so there's cross-learning as we go through different experiences and learnings as well. That's important. And I think when we do have that and spreading it provincially, so we have consistency in how we apply those guidelines, are also an important aspect of how we've been effectively responding to COVID-19 pandemic as well.
Great, thank you. Well, we have had great questions this evening, and thank you very much for submitting this. Leah has another really great one that I think is on just about everybody's mind. And Leah is asking, should we be concerned about a second wave?
Yes, that's on everybody's mind. Yeah. So the answer will be a little bit long. So this is COVID-19. This is a coronavirus. We actually are more used to pandemics that are due to influenza. This is not influenza. It's a different virus. And so what we see and expect with an influenza pandemic might not be what we will see in a COVID pandemic or coronavirus pandemic. So what does that mean? It means that, well, a number of things. One is it is possible that we will see a second wave in the fall. That is very possible. A number of viruses are seasonal in nature, respiratory viruses in particular. And so that could mean at some point in the fall, and when exactly, we don't know, but it's end of September, October, November, December, there could be a resurgence just by virtue of the seasonality of this, but we don't know that. So it is possible. Now, maybe there is no second wave, just because the coronavirus that's the way it behaves. We don't know that. But at the same time, if we were in a situation where COVID-19 would come back as a second wave, what we know is we've implemented measures that are still here in place, very strict measures. Even though we're releasing some of them, we're still doing it in the new normal way of doing things. And so that means we're going to do things with protection in place. We're going to maintain our distances. We're going to wash our hands more often. We're going to have barriers. We're going to wear masks in certain situations. All these things will make a big difference. And so that's why before we get to the actual end of the pandemic, which is when we have what we call community immunity. So everybody is immune, or enough people are immune to it that it cannot transmit anymore, or we have a vaccine so that people are immune due to the vaccine, and so then the virus is not able to find somebody who's susceptible to transmit to others. Or if we have an excellent treatment where it doesn't matter as much if people get sick because we have something to treat it. So until we get there, which would be the end of the pandemic, we'll maintain a number of measures. And so the measures we have in place now will make a difference. And I think it will interestingly, make a difference on other respiratory viruses, and it should keep them at lower levels than we would see them otherwise. So it's reassuring in a way that even if there would be a second wave, we already have measures in place to keep it down, and we are also keeping a very close eye on this. And so if there is any significant increase, we could reapply some of the measures. And again, it would probably be gradual, but we have ways, we know now, we have ways to control this. And so the future will tell, but all that being said, we are making sure we are ready for a second wave if it comes. That's what's important.
Great, thank you very much. The next question is from Rita, and she asks, when will visitors be allowed into long-term care and hospitals?
Yes, that's actually a question that we get fairly often, actually, because it is very difficult for family members and friends and loved ones to not be able to see their loved ones in long-term care facilities in particular. It is a hardship, it is difficult. And so now, that being said, it's also extremely important that this population are at such high risk of COVID-19, its severe disease and complications, including death, that we have to maintain very strict measures, including preventing visitors from going in unless in very specific, essential circumstances. And so we're trying to promote, and we've mentioned that many times, and operators are doing this, is that to promote other ways of connecting. I think the connection socially is extremely important. It's not the same, it's still very difficult. And, but we can connect electronically, phone calls or video chats like the one we're doing tonight are possibilities. In some places, I mean, on the main level, through the window, there is a way to, some people visit like that. We are looking at ways for this summer to allow visits outside. Now, it's not as easy as it seems, and so we're working on that. But if it's possible, when the days are nice, then maintaining distance. We don't want to have direct contact between people, but at least you have the visual, the in-presence connection, if you will, which is very important. I think we're very social. The human race is very social, and it's very important. And we understand it's very difficult. But we're doing this for a good reason. We're trying to protect people's health and their lives as well.
Great, thank you for that. So Deborah has an interesting question here. She says, I've seen so many people now coughing and sneezing with no masks on, and it scares me. But it's also allergy season. So should these people be staying home sick now, or should they be out and about?
Yeah, I understand the concern there for sure. So when you see somebody coughing or sneezing, you never know exactly what is causing that. And it can be COVID-19, but it can be also something else. And allergies certainly, and quite a few people actually in our population are suffering from allergies, which is very unfortunate. It's a very annoying condition. And so, well, two things. First, if people are following the rules, following the recommendations, and doing the right thing, and I think people are, because we've seen such a nice flattening of the curve. So it means that people that you're seeing are probably suffering from allergies. Now, that being said, some people are going around while they're sick, which is very unfortunate. This is not what should happen, and that puts other people at risk, of course. And so we keep reminding people not to do that. So if you see somebody sneezing and coughing and you're not too sure, you can certainly keep your distances, or you can make a comment. So like you can ask, or but certainly keeping your distance can make a difference. And so some people are going out there while they're symptomatic with a respiratory infection. And so again, I think we want to repeat the recommendation. Stay at home when you're sick. Do not expose others to COVID-19 if you're sick. So keep your germs to yourself. And that's extremely, extremely important. So it gives me an opportunity to remind people of that. Stay away from other people when you're sick. If you have allergies, that's different, but people don't know that. So I can understand the reaction. So I hope it helps a little bit to clarify that.
Thanks. Yeah, that's a tough one, especially during allergy season. So the next question that's kind of breaks my heart, and I think this is probably a really good example of the sacrifices people have had to make, but and also speaks to, you know, how everybody's done what they needed to do. But anyway, this is from June. I'm a healthy 75-year-old. Is it safe for me to hold my great-grandson?
Oh, that's actually a question that opens up a few questions. So it depends. Your grandson, in this case, I would assume the grandson is not living with you. So when you bring somebody else in your life and you're in contact with you, you bring their contacts in a way to you. And so ideally, we recommend usually not mixing households, but that is not always possible. And there are ways to reduce the risk significantly. So if your grandson and his family have actually have been very, very careful or have isolated themselves to stay away from anyone who is sick, then the risk is probably extremely low. And if the grandson has no symptoms at all, but it's not a guarantee. There's still a risk. And so it's your decision in terms of accepting that risk, even though the risk might be extremely small. So there are ways to reduce the risk. Again, is as long as on the other side, the other household is extremely safe and follows all the recommendations and stays away from any risk, then it is much safer for you, and then it makes it possible.
Great.
Great. So we just have about 5 minutes remaining. So I want to thank Dr. Lee and Dr. Lavoie for answering these very important questions. I do think we had some great questions this evening, but we are winding this down now with just a few minutes left over. But I want to assure anyone that has had a question that we weren't able to answer tonight that we will do our best to answer those questions outside of this town hall. So there's just one remaining question, and it's my question, and it's back to the use of masks. So we have a lot of people making their own homemade masks, and as you said, Dr. Lavoie, you can make it even out of a t-shirt. But what is the life expectancy of a homemade mask, and how often should it be cleaned, or what is the use? Is it, if you went out one day for 15 minutes, can you use it again? If you used it for an hour, 3 hours, all day, what's the time frame of when you should use your homemade mask?
Yeah, I don't think there's actually a very exact answer to this, but I'll provide a few thoughts on this. So when you wear a mask, as I said earlier, I think it's mostly to capture the droplets that you would expel from your mouth when you talk or if you cough. And so mostly the mask would be potentially contaminated with your own secretions. And so you could certainly wear it again. Now, it's probably not ideal, and also you're going to be breathing through it. And so maybe washing it daily and having maybe a few would be a good idea. But again, it's mostly with your secretions that the mask would be contaminated if you were to have any infection. So you wouldn't be creating a risk to yourself in that way. Of course, if you wear your mask and you take it off and you put it on a surface as you go out in public and all that, you could contaminate your mask. And so I would advise not to wear it again before you wash it. So that would be different. But if you keep it on around your neck or you wear it all that time when you're out and you come back, washing it daily would be probably quite acceptable.
Yeah, and I
Right.
think just to add to that, because that's an area of a lot of interest, as soon as it's soiled or wet, it's a good idea to wash them. But I think sometimes people have that false sense of security that you have a mask on, and then you tend to touch your face more. So it's really important that you're not touching your face. And again, practicing hand hygiene, so washing your hands before and after that you put it on, as well as after taking it off.
Great. Well, thank you very much, Dr. Lee and Dr. Lavoie, for your time. And obviously, it's been very difficult for communities around British Columbia. And of course, my community has been no different. You mentioned the federal prison outbreak, for example. That was very, very challenging. Of course, we've all had long-term care facility outbreaks. We had Willow Retirement Community Hall in Maple Ridge and Cedar Brook retirement residents in Mission and others. But I have to say, and I'm sure that everyone in the legislature would concur, that residents of BC and residents of my community have been amazing. And they were called to isolate themselves, they did. They were called to wash their hands, they did. They were called to social distance, and they did. And the stores, like our local Bruce's Market or Meridian Meats or Save On Foods or Langley Farm Market or Rona or any of these businesses did everything they could to make customers and staff feel safe. And now that we're in phase 2 startup, owners of restaurants and services and stores all over BC, and of course my riding as well, are actually asking the right questions. And they're doing that because they want to create an environment that works within Dr. Bonnie Henry's guidelines. So I want to take the moment to thank everyone for joining us tonight, especially our guests and of course my wonderful co-host, MLA Joan Isaacs, and also to thank Health Minister Adrian Dix and Dr. Bonnie Henry for every day coming and talking to us and doing everything they're doing, and the government, of course, our government, for taking the action to continue to work hard to support British Columbians. And but before we wrap up, there's a few resources that I think would be nice to share. So MLA Isaacs, would you like to share?
Sure. And thank you, Bob. And thank you again for everyone who's joined us this evening. It was a good session. And again, thanks to the doctors for providing such valuable information. So just a few resources to leave you with this evening. If you're looking for provincial support and COVID information, you can visit the website, which is gov.bc.ca/COVID-19. The website includes non-health related information such as financial information, childcare and education supports, travel and essential service information. If you can't access the information by website, it's also available by telephone. You can call 1-888-COVID-19. That is 1-888-268-4319. And that line is open 7 days a week from 7:30 a.m. to 8 p.m. Pacific time. If you're looking for the latest medical updates, including case counts, prevention, risk and testing, you can visit the BC Centre for Disease Control website, and their website is www.bccdc.ca.
That's a mouthful. Thanks, Joan. And if you're a family member and need additional medical advice, please call 811. And for seniors looking for additional support at this time, please call 211 or visit bc211.ca. You can also go to bc211.ca to sign up as a volunteer to support seniors to stay safe. And anyone in the Fraser Health region who has questions or concerns about their care experience with Fraser Health, please contact Patient Care Quality Offices. The Patient Care Quality Office. The toll-free number is 1-877-880-8823.
Great. And you can find more information and links to these and more additional resources in the description of the town hall, which is below on your screen. If you haven't already done so, please do fill out the province-wide public health survey. BC COVID-19 Speak, your story, your future. Local data is essential for communities to help support public health planning. Your input equips medical officers across BC to help our health and well-being as we learn to live with COVID-19. The survey only takes about 10 to 15 minutes to complete, and you can do it online at bccdc.ca/COVID-19 survey, or again by telephone at 1-833-707-1900. And that telephone line is available 7 days a week between 8:30 and 4:30 p.m. So be sure to take the survey.
Great. And I will try to channel my Dr. Henry here. So as we move into phase 2 of the BC Restart Plan, let's give this every chance to succeed, because we all are still in this together in this phase, and we have to continue to do what we've been doing. That is staying 100% all in. So let's continue to follow the public health guidelines to protect ourselves and our loved ones and stop the spread of COVID-19 in British Columbia. And so for more information on our BC Restart Plan, please visit gov.bc.ca www.ccc.ca/restartbc. I want to take the opportunity, of course, to thank everyone for doing everything they're doing to fight the pandemic and for joining us this evening. Keep well, be safe, and most importantly, be kind. Good night.
Well
Good
said.
night.
Good night.
Good night.